For fiscal year 2022, the University of Illinois system budget is $7.2 billion. The system is composed of 3 universities, in Urbana-Champaign, Chicago, and Springfield, a hospital and healthcare system, and system offices. The budgets of the 3 universities, the hospital, and the system offices together make up $7.2 billion. The U of I system's revenue comes from multiple sources: general operating funds, used to support instructional and other academic activities; restricted funds, money that can only be used for a specific purpose; hospital funds that are associated with UI Health, which deliver care through the University of Illinois, Chicago Hospital and clinics. 20% of the total budget, or $1.4 billion, represents payments for pensions and employee health benefits that the state pays on the system's behalf. The rest of this video will focus on the $5.8 billion that support all the activities of the system and these 3 categories. Shown here are the different sources of revenue that make up the $5.8 billion. General operating funds consist of state appropriations, tuition, royalties, and assessments earned across the university system. This determines how much money can be spent on instructional activities, faculty and staff salaries, student financial aid, instructional facilities, and student services like counseling and advising. Restricted funds include revenues that typically cannot be used to fund general academic operations. They include sources which generate revenue for specific purposes: athletics, housing and dining, student unions, recreational facilities, and patient care are some examples. Other sources of restricted funds are grants, federal appropriations for agriculture programs, gifts, and endowment income. The University of Illinois system consistently works to bring federal and private dollars into the state in the form of research grants and philanthropic support. These funding sources are typically restricted to specific terms and conditions set by the grantee or donor. Direct state support and tuition are the 2 most important components and resources for our academic endeavors. For public universities across the country, including the University of Illinois system, direct state support has declined significantly, placing a larger financial responsibility on students and their families. 20 years ago, the state provided $3 in direct support to the university system for every dollar in tuition revenue. Today, there is $2 of tuition for every dollar of direct state support. At the same time, system-wide enrollment has increased by over 26,000 students. The system's 3 universities enroll half of all students attending public universities in the state. The budget helps the system to deliver on its mission and supports instruction, cutting-edge research, student services, patient care, and facilities operations. The 3 largest categories of expenses are for instruction, research, and patient care activities. About half the system's budget is used to support people through salaries and benefits. Although operations are returning to a more normal state, the pandemic beginning in 2020 brought on significant financial challenges. The system has incurred considerable additional expenses to protect the health and safety of students, faculty, and staff. Examples of the financial impact include refunds to students, lost clinical revenue, lost auxiliary revenue, and unanticipated costs such as testing and cleaning, and change in instructional delivery. Several cost containment efforts were implemented at each university to mitigate a portion of the costs of the pandemic. In fiscal years 2020 and 2021, the system's costs related to the pandemic reached over $330 million. The Federal CARES Act, along with state assistance, provided essential relief to higher education and offset $180 million of these expenses, with the remainder funded by the 3 universities and system offices. Federal and state assistance also provided financial support to healthcare providers, including UI Health, to help offset revenue losses and expenses related to the pandemic. As of fiscal year 2021, the hospital has received $123.8 million in relief. Despite these challenges, over the last decade, the 3 universities have continued to expand institutional financial aid, nearly doubling to $261 million in 2021. Institutional aid provides more aid than federal and state combined, when excluding funds from the CARES Act. Thanks to the leadership of many people across the institution, the system has been able to manage its finances prudently during these challenging times, ensuring the University of Illinois system remains altogether extraordinary.